The cherry eye is a condition where the third eyelid glands, this is the nictitans membrane gland, which is the third eyelid of our dogs and cats, prolapses. So, meaning this gland will slip out of its physiological position, its normal position, and it will become visible. The exact cause of cherry eye is not well understood, but it is believed that it starts from a weak connective tissue surrounding the gland. This connective tissue normally will anchor the gland in its normal position, but some dogs will have this connective tissue weaker than the normal, and they will not do their job properly, and the gland will prolapse. A few dogs are more predisposed than others for this condition. Now, all dogs can present this condition, this pathology of the cherry eye, but a few breeds are more predisposed than others. And here we are thinking of the American Cocker Spaniel, the Lhasa Apso, the Beagle, the English Bulldog, the French Bulldog. Those are usually the breeds that we see most often. Typically, we will see this condition in dogs that are younger than 2 years, but we can sometimes see it also in older dogs, although it is more rare. The most common signs of and symptoms that we see in the cherry eye will include a smooth, pinkish, reddish mass at the corner of the eye, the nasal corner. The dog can present some watery or mucus discharge. We can have some conjunctival redness, some swelling. Some dogs will scratch, not always, but some dogs will try to scratch this prolapsed gland. And in a few cases, we can have a reduce in tear production, which is a complication of this pathology. If untreated, if it remains without treatment, it will create a chronic inflammation and sometimes a secondary infection. For the diagnosis of the cherry eye, usually it is done through an ophthalmic examination. Although the diagnosis is easy enough, also for the client, we can see a reddish ball at the corner of the eye. In most cases, this reddish ball will be the gland, but sometimes, although again it is rare, we can have a few conditions that will mimic this gland prolapse, and we should be careful in distinguishing between those conditions that can be more serious and the prolapse of the gland that can be treated and the dog can have a normal life. If we want to talk about the risks of an untreated cherry eye, leaving the cherry eye as is will most commonly create a persistent conjunctivitis. We can have some ocular irritation, some damage due to self-trauma. As I said, some dogs will try to scratch or rub this lesion, and it can create more irritation, more inflammation, and sometimes infection. And with time, with chronicity, we can have a reduced tear production, leading to dry eye, a condition that we call keratoconjunctivitis secca. So, now let's talk about the treatment for this condition, the cherry eye. We have two ways of doing this. We have the medical management and we have the surgical repair. Now, for the medical management, it can only be used when we have a mild case of cherry eye. We can prescribe some topical anti-inflammatory drugs, but therapy alone for this condition is rarely enough. And long-term, the surgical management of this condition is preferred. Now let's talk about the surgical repair, the surgical option for the cherry eye. The preferred treatment is the surgical repositioning of the gland. We should never remove the gland. In the past, that was the solution. We excised and removed the gland. But now we know that this approach greatly increases the risk of dry eye. We know now that the gland plays an important role in the tear production, and we should never just remove it. What are the options? Well, there is two options again for the surgical approach. We have the pocket technique and the anchoring technique. For the pocket technique, basically, we create a small pocket in the inner part of the membrane and we put the gland inside. So it's creating a little house and we close it with absorbable sutures so the gland stays behind the third eyelid. The second surgical option is the anchoring method. This means we will take the gland and we will anchor it. We will use sutures. We will suture it to orbital tissues, for example, the periostal tissues. In this way, it will maintain the gland in position. We don't use this technique in all dogs, but some dogs are more predisposed to forms of cherry eyes that respond better, and these dogs have a high risk of reoccurrence if we only use the pocket technique. So we put the two techniques together to have the best results. It is important to note that with this combination of techniques, with the techniques that we choose depending on the presentation and the breed, we usually have a 95% chance that this gland will stay in place and will not come back. There is, unfortunately, no technique that ensures 100% chance that the gland will not resurface, will not reprolapse. But with these techniques, we have a very, very low chance of reoccurrence, and sometimes it happens we will have to re-intervene again in some of these dogs, but the end result is almost always satisfactory for the dog and also for us. Now that we have done the surgery for the cherry eye, let's talk about what can happen after. Let's talk about the post-operative care, what the client should do after the surgery, and let's talk about some of the possible complications. So for the job of the owner, let's say of the dog, we will have 1 to 2 weeks of topical eye drops. Nothing very difficult to do, but it is important to put this topical drugs. Sometimes we will add oral medication depending again on the case. Another thing that is important to keep in mind is that this dog or any dog after this kind of surgery will need to wear an e-collar to prevent the dog from scratching. There are some sutures inside. They are very, very small, but sometimes the dog after this irritation, after the surgery, will try to scratch. And the more he scratches, the more he creates an inflammation, and the inflammation will invite more scratching, and it's a circle that we want to avoid. It is important to note for the owner, when you take back the dog from just after the surgery, you will notice that the membranes are red, almost as if the surgery was not done, because we still see this, let's say, little redness on the nasal corner. It's normal. We just worked on this eyelid. It is normal to have an inflammation, and this inflammation will disappear with time. 10 days, 2 weeks post-surgery, the eyes are absolutely normal and the gland is in its normal position. Let's talk about some of the possible complications of this surgery. We can have, as I said, a recurrence of the prolapse, rare but can occur. We can have an infection, as in any surgery. We can have some corneal irritation, although extremely rare. It can happen. We can have some reaction to the suture material, and we can have some cyst formation. All these complications are extremely rare. We almost never see them, but it is important to know them. It's something that we explain to the clients every time they want to operate their animal for the cherry eye, but we rarely see any complication for this surgery. It is one of the surgeries that present very few complications. If you have any questions, please don't hesitate to ask us, and we will be glad to answer any of your questions. Thank you.